Thank you, everyone, for making time to come to our first back in person Make a Difference discussion. And I'm very pleased to welcome Lesley Hendry from Sistering, one of the only agencies we were chatting, perhaps in Canada, that is entirely dedicated to serving vulnerable women who are homeless or facing other challenges. So with no further ado, here's Lesley Hendry. Thank you.
Thank you so much. Thank you for having me here today, and apologies for the delay. This is Sistering. So if you go to the next slide, Sistering is a multi-service agency. We've been around since 1981. We're located at Bloor and Dovercourt. So recognize it if you're driving by. There's a big purple building that says Sistering. That's us. We provide emotional and practical support to women and gender diverse people. We've been a leader in Toronto for over 40 years, and we are a safe place where all individuals are valued and treated with dignity and compassion. So who we serve? So we're a low barrier agency, and we serve exclusively women and gender diverse people. Most of the people we serve are experiencing homelessness, poverty, food insecurity. Many have substance use issues, mental health issues, physical disabilities, chronic illness. We have many immigrants and refugees, people with experience with the criminal justice system. Nationwide, there's about 36% of people experiencing homelessness identify as women, but studies show that that number is quite underestimated because women's homelessness is very much hidden. I'll get into on the next slide. So Sistering is Toronto's only 24/7 drop-in exclusively for women and gender diverse people. So our doors are open around the clock. Like I said, there's people coming from the airport. Refugees are coming directly from the airport to Sistering's doors. We have people coming directly from the hospital, from prison, people fleeing domestic violence. So it's a safe place where you can go, and it's low barrier, which means you don't have to fill out a lot of paperwork. You don't have to have ID. We're trying to remove as many barriers as possible to service. One of the reasons why it's so important to have gendered specific care is that violence is a really big issue for women who are experiencing homelessness. So 91% of women in Canada who are homeless have experienced assault in their lifetime, and trans women are 3 times more likely to face violence. And because our homeless service sector is very male-centric, there's not a lot of services that are really dedicated to addressing the needs of women. And because of this and the predominance of violence, many women will kind of do anything to avoid the shelter system. So they become hidden homeless, which means they might be living in unsafe conditions, staying with a violent partner, living in their car, couch hopping, that kind of thing. So they might not be counted in the traditional statistics for homelessness because they are doing everything they can to avoid it, but that doesn't mean they have a stable, safe home. Next slide. So just a quick overview of some of the programs that we offer. So our 24/7 drop-in is kind of the heart of Sistering. We provide kind of all the basic necessities: bathroom, shower, internet, laundry, and we have social rec programs. We have crisis intervention. So like I said, you can come in and you can get a warm pair of socks and a shower at any time of the day. Our food access program I'll get into in a moment, but basically it serves 3 warm meals a day. We have an on-site medical clinic. So in partnership with Inner City Health Associates and the Jean Tweed Center, we have doctors and psychiatrists on site 4 times a week, which is one of the biggest medical clinics, community medical clinics in Toronto. So this obviously, it's low barrier. Again, you don't need an OHIP card. You don't need citizenship status. You can get access to basic health care where you're feeling already safe and comfortable and where you have a support worker in place. So it really enhances health equity for women. Slide. Follow-up case support. So we have case management services for people who are exiting homelessness and might need assistance with kind of making that transition. We have a big harm reduction program, which I'm going to get into a little bit. And we have research and advocacy. So we work with academic institutions and hospitals and other community agencies to address the root causes of homelessness and poverty for our participants. So just a few stats. So we have our 24/7 drop-in on Bloor. We also have a drop-in in Parkdale, which is 5 days a week, not 24/7, but they provide a lot of the same. Okay. They provide a lot of the same services. So between those two drop-ins, we had about 45,000 participant visits last year, made almost 12,000 referrals, and had 339 social programs and activities for our participants. All of our work is anti-oppressive and trauma-informed, person-centered, so there's no timeline, there's no agenda. It's really just based on the individual needs of our clients. Low barrier, as I mentioned, housing first, which just means we can't address any mental health concerns or substance use issues or employment or education until people have safe, secure housing. And all of our work is focused on creating a culture that's conducive to the safety, empowerment, and healing of all participants. So our food access program, I'm sure many of this you already know. I know you're all very involved in the community, but we're in a major food crisis here in Canada and Toronto specifically. So right now, Food Banks Canada reported 2 million visits to food banks across Canada and 4.1 million meals distributed, which is the highest number ever recorded. Toronto just identified food insecurity as an official crisis here in Toronto. So 1 in 4 people are food insecure and 1 in 10 households rely on food banks right now. So obviously with everything going on with Trump, that is likely to get worse. So our participants are clearly having to make choices between shelter and food, and it's pretty scary. So the demand for our food program is rising and the expenses are rising. So it's a pretty big concern for our community. So last year we served about 131,000 meals. So that's breakfast, lunch, dinner, and snacks for community members that are in Sistering, and then we provide some meals to different buildings across Toronto as well. Spun Studio, so this is our social enterprise. It's a community art space. And participants learn textile arts like sewing, knitting, crochet. We also do like candle making, jewelry making, that kind of thing. So it's a really great opportunity for people to come together and be creative. We have a lot of seniors that attend this program, so it's really good for social isolation and cognition. And then at the same time, the participants can supplement their income because their items are sold at our little shop and online, and they keep 50% of the proceeds, and then 50% is reinvested back into the studio. So this is just a quick glance at some of the products we make. The craftsmanship is actually amazing. You should see some of the knitted materials are awesome. And we do upcycling and jewelry and that kind of thing. And then we also provide alterations and repairs, and we do corporate events at the studio. So it's a really kind of fun, bustling social enterprise we have. And we're working to get it a bit more employment focused so that people are not only learning these skills, but also learning kind of how to develop their business and become kind of have this independent side hustle. Our harm reduction program is, again, it's one of our core programs at Sistering. It's all peer run, which means everyone who delivers the program to have lived experience with drug use. So this really helps people feel like they're in a safe, non-stigmatized environment, and they're more willing to engage and share. So they prepare harm reduction kits with safe use supplies. They deliver workshops and awareness about how to use safely and kind of overdose prevention, withdrawal management, kind of all the issues that you might face as somebody that uses drugs. This program is basically completely unfunded now. We're working hard to get funding back for it, so in the meantime, we're kind of cobbling together funds to keep it running. But it's a tricky one. Not everyone wants to fund this program. I'm not gonna go through all these slides, but basically it just means harm reduction is evidence-based. It works to reduce overdose mortality, reduce disease. It's cost-effective. It costs a lot less money to run programs like this than it is to have constant paramedics and hospital visits. And as you probably know, we've got 5 safe consumption sites closing this year in Toronto. So Toronto Public Health thinks that will become quite concerning. So in the last 5 years, paramedics have had a 54% increase in calls related to drug toxicity, and they expect a further increase as more people use drugs unsupervised. And from 2020 to 2024, there was almost 400,000 visits at Toronto's supervised consumption sites, and staff responded to nearly 11,000 overdoses with no fatalities, which is pretty awesome. So our harm reduction last year, we delivered 26,594 kits, just over 5,000 naloxone kits. We supported 2,400 outreach clients in the community, so that's not within Sistering, but at different supported housing sites and locations across Toronto. And 569 clients received additional support like housing or detox support. And I have a testimonial from one of our peer workers there. I'll read it, sure. I'm a harm reduction peer at Sistering, and I've been in this position for 7 years. I'm passionate about serving diverse women in the community and helping them make healthy choices. I've seen that harm reduction services, including outreach and Narcan kits provided to at-risk people, save lives. I've struggled with addiction and understand the challenges of addiction and being more at risk due to being a woman. I'm sober today, and I believe Sistering has helped me achieve a healthier lifestyle. I love my job because I see women keep coming back to Sistering, and we have so much fun at our events. I'm looking forward to swimming this summer with the gals at Christie Pits. I've made many valuable friends at Sistering, and Sistering saved my life. So again, the peer workers, not only does it enhance the programming, but it provides supplemental income for them. It allows them to develop skills in the workplace. So it's a great program. Follow-up case support. So as I mentioned, we have a case support team that works with individuals as they transition from homelessness into housing. There's a high rate of eviction after homelessness because individuals might not be equipped to, maintain their housing. So our case support workers have really, intensive one-on-one case management support with whatever the client needs. So it could be like hoarding or pest control issues or mental health. They'll help them get their groceries and clean their house. They're just kind of in there. They're liaising with the landlords and the other mental health providers just to make sure that people can keep their housing and they're not repeating the cycle of homelessness. So the city of Toronto reported that almost 12,000 people were staying in the shelter system right now. I think it was about 10,000 at this time last year. So obviously our system's quite strained. The spaces are over 99% full on any given night, so basically 100. And that doesn't include anyone that's staying at a shelter that's not run by the city, like a private rooming house or in encampments or on the street. So that would probably be about 1,000 additional people on any given night. And there's about 94,000 people on the wait list for subsidized housing right now, and that wait is 10 to 14 years. So some of the challenges that Sistering is facing, except for all of the millions of step challenges I just listed. Funding, obviously, is a huge concern for all charities. As I said, the resources are kind of dwindling and the expenses are soaring. So the city of Toronto, for example, they're providing very small increases year over year, whereas our expenses are, it's not really keeping up with the expenses. So our fundraising target is getting higher and higher to kind of make up for that difference.
Can I ask to get funding from the province?
Yes, we get funding from the City of Toronto, Ontario Health, specifically for the medical clinic, and some of our peace support. And then we have a little bit of federal funding as well, and we're a United Way anchor agency. So that's kind of our core funding. And then the rest of it is fundraising. So our annual budget is about 6 million. So funding, obviously, it limits our ability to innovate and grow and provide creative programming to meet the evolving needs of our participants if we're always struggling to pay the utility bills and fix our toilets and that kind of thing, which is kind of what's happening. And it also, of course, limits our ability to keep up with competitive wages. So keeping our very hardworking staff motivated and retaining them has been a challenge. And then I was mentioning to someone here that the space, we were thinking about moving to a larger location, and that wasn't feasible. So we're staying put for the time being. We have 16 women sleeping on mats on the floor every single night. It's not equipped to serve as a shelter. It's kind of just an emergency situation. And we don't have enough private areas. So everyone's kind of just in one area, which is okay some of the time, but you have people having, you know, extreme mental health crisis next to someone who's just arrived into Canada for the first time. There's no privacy, there's no space, there's no outdoor space, there's limited lighting. So we're working to make do with what we have. We're hoping to do a big reno and make better use of the space, but eventually the goal would be to move to a bigger location to meet the needs of the community more effectively. How you can help, obviously, we're always looking for monetary donations. So again, unrestricted donations is really helpful in paying those bills. Like the stove in our kitchen broke last year and it was $10,000 just randomly that we had to find. So those unrestricted donations really are quite helpful. But we also appreciate if you want to donate to a particular program, like if you are passionate about the Spun Studio and want your donation to go directly to that program, that is wonderful also. There's no program that's overfunded. Monthly donations are really great and just keeping a steady flow of cash coming, so no donation is too small. $5 a month is amazing. And then of course, gifts of securities and bequests in your wills are also great ways to give. I also like to remind people that if you're not in a position to give individually, you can always mention it to your company. Perhaps International Women's Day is coming up and companies always want to show that they're giving back to women's organizations. So please keep sistering in mind. We have a few events that happen throughout the year. So we've got Coldest Night of the Year coming on February 22nd. It's a family-friendly walk. So you just register a team and get some friends or colleagues together and fundraise. Again, no amount is too small. It's just the idea of kind of coming together for your community. And we walk 3 kilometers. It's easy and super fun. And then donating in kind is always helpful. The items that we need most are hygiene items, soap, shampoo, toothpaste, toothbrush, and the basics. Pads, adult diapers are a huge one. We never have enough and they're expensive. Socks and underwear, especially plus sizes. Those are kind of like the biggies. But just contact us if you have questions about kind of items to give. Unfortunately, because our space is so tricky, we don't accept used clothing at the moment. We just don't have the resources to store it and organize it right now, but hopefully that will change in the future. And last but not least, just spread the word. Again, if you're not in the position to give, totally okay, but you can tell a friend, you can share our content on social. Just keep us in mind if there's ever an opportunity to give back to a community charity. So it's right on Bloor and Dovercourt, between Delaware and Dovercourt. It's a big purple building. I think there was a picture of it on the presentation, but once you spot it, you'll always see it because it's bright purple.
What about the craft area? Where's that?
It's right across the street. Yeah, Spun Studio is right across the street. So it's 962 Bloor and 957 Bloor. Yeah, we're kind of in the same position where we're turning away volunteers, unfortunately, again, because the lack of space. So we have volunteers in our kitchen, which are really helpful, and kind of a few sporadically kind of across our organization, but there's not a lot of resources and space for volunteers. So right now we're at capacity. That said, there's programs, so people, if they have a specific skill or program they're hoping to run, that is always helpful. So, you know, like a yoga class or resume writing, that kind of thing is really great. And then we always are looking for volunteers for our events, but in terms of kind of a regular volunteer shift, those ones are a bit trickier. So that's why I always say, like, the worst job in the world is a housing worker because it's so hard. I don't know that I have an answer. They work their magic. I guess we have a network of private landlords. We have community agencies that we work with, like Wood Green and Toronto Community Housing, where we're able to house people from time to time, but it's bleak. It's really bleak. And again, like, I can't stress, like, these mats on the floor are like gym mats. They're not even long enough for a human body. And people are voluntarily sleeping there every night because it's comfortable and safe and warm, and they have no place else to go. So it's not great, but I guess the housing first philosophy is that, you know, it's very difficult to work on your employment and kind of larger issues when you're sleeping on a mat every night. Again, I'm working in fund development. I'm not frontline. But from what I gather, the lock zone kits are just they're saving so many lives. So you saw we gave out about 5,000 last year, and people are just constantly out. We have like a window on Bloor, and we serve men and women are able to get the harm reduction kits, and it's just a constant stream of people getting them. So I think it's really making a huge difference. But yeah, you saw the stats, like 45% increase in the last 5 years in overdoses related to fentanyl. Like, that's what's killing people. And I'm applying for funding right now for the harm reduction program. So I've been talking to different housing providers that have high drug use in their buildings, and yeah, they've got a lot of fatalities on their hands because of it. Both are needed. Like, we have people that come in that aren't quite ready for long-term case management. They're not motivated. They're not there yet. So I think sistering is really all about just helping people where they are at their journey. And if they're just coming to get socks and have a meal and take off, then that's fine. And if they want to sit down with our counselors and talk about, you know, what's the next step for them, even better. But we're just kind of there to meet people where they're at. So many people who are experiencing homelessness, they find a lot of comfort in going to the same place over and over again. So we do find that's a bit of a challenge, that people kind of get stuck at sistering because they know they're workers and they have their friends and they have their routine, and then they kind of just get stuck. So a big part of what our frontline staff do is to kind of motivate them to take that next step and to apply for housing and apply for employment programs and that kind of thing. But it's not always easy, especially when people have a history of trauma. The idea of just a comfortable, safe spot is very alluring. So we're never going to discharge someone after a certain date. It would be more about just kind of working with them to try to get them to, you know, take the next step. But like I said, we're very person-centered, and we're not going to turn anyone away for that reason. So if they're coming from the airport, I don't actually know the answer to that question, but I think that they would probably get referred to us either by the City of Toronto or word of mouth, maybe border services. I'm not really sure. The police obviously know about sistering. So, but my guess would be City of Toronto. They would call 311 or whoever, and they would say go to sistering. Language learning support, I think so, yeah, I think that would be helpful. We have different language focused groups, so we have like an Arabic speaking group, I think a Mandarin and Cantonese group, so there's a variety of different groups that already are happening, but we can always use volunteers for like specific skills like that, I think.